Hi everyone, we're working with blood again today. We seem to have had quite a few blood transfusions recently, and it becomes quite interesting because apart from having to do blood typing in pets, we also sometimes have to do something called cross-matching, which is where we take a sample of the donor blood and the recipient's blood to see whether there has been any reaction towards one blood or the other. The reason why this is important, especially if we're having to do multiple transfusions in patients, is because sometimes, although they are the same blood type, they can react to a second blood transfusion. And so by doing a cross-matching, we know that if there isn't a reaction in the cross-matching slides, we shouldn't have as much of a risk with giving that blood to that patient. Unfortunately, there is always going to be a risk when we have to do blood transfusions multiple times with individuals. So we're trying to eliminate as much of that as we can. So we have a couple of slides down here. We've already started the process, but basically what we do is we take a blood sample from donor or recipient. We do this between the two, so kind of each one will have the same thing done, and vice versa. That we'll be taking a sample of the red blood cells from we'll call this the donors. We're going to put a drop on there, and then we have spun down some of the recipient's blood to give us the serum here, and we're going to take a sample of this and put a drop on there. I'm going to put a little extra because there was a half drop in there. And we want to move this around turn it around, essentially mix it up a little bit. Okay, so in this case, at the moment, we don't have any clumping, so the red blood cells and everything's nicely together. Just ignore that little spot there, that bubble. I'll just move that off to the side. It doesn't want to go. So at the moment, this looks good. We don't have any signs that this is going to be an issue. To give you an indication of what is a really good outcome, is here we've got a very nice sample. We've got you can see that it's all combined. It's like a nice red spot. We don't have any speckles in between, and this means that the bloods are not attacking each other, and we are safe to go ahead with a transfusion. This is an indication of that we might have some agglutination or some of the cells not gelling with each other. So you can see that kind of we've got that little speckled appearance around there, and yeah, and so that obviously is not a good sign that we can use this specific donor with that recipient. So as I say, it's not. We have to still be careful in the case of blood transfusions, because any dog that has had multiple transfusions can have reactions. But it is another way of just trying to minimize that reaction as much as possible, and hopefully come out with the outcome that we want.